How to increase blood pressure at home for people with low blood pressure. Hypotension occurs when systolic blood pressure is less than 90 mmHg. Hypotension can happen to anyone. Young women and thin people are at higher risk of hypotension. Causes of hypotension include effects of cardiovascular diseases, side effects of Western medicines such as Parkinson's drugs, antidepressants, diuretics, etc. People with problems related to endocrine disorders. People with unscientific diets, nutritional deficiencies. Patients who regularly use alcohol and tobacco. People with diabetes. Frequently changing positions suddenly. Symptoms of hypotension that patients may experience include dizziness, lightheadedness, uncomfortable headaches, blurred vision, unclear, nausea, vomiting, body fatigue, weakness, rapid breathing, labored breathing, poor concentration, confusion, memory loss, instructions for handling low blood pressure. Lie down on the bed and prop up a high pillow. Drink plenty of water, but drink small sips. Immediately supplement with a piece of chocolate, cheese, milk, yogurt, cereals, or raisins. Or drink ginseng water, ginger tea, coffee, or strong tea. If the symptoms do not improve, go to the nearest medical facility for timely support from a doctor. Ways to increase blood pressure at home. Use salt water. One of the simple ways to increase blood pressure that patients can quickly apply is to drink salt water. Drink lemon water. A glass of lemon water containing a lot of vitamin C is one of the ways to increase blood pressure at home for patients. Not only does it help stabilize blood pressure, it also helps improve resistance and supplement the body with the necessary amount of vitamin C. Drink coffee, tea. When suffering from low blood pressure, patients can drink a cup of coffee or tea to temporarily stabilize blood pressure thanks to the stimulating effect of caffeine. Use medical compression stockings. Using medical compression stockings is an effective way to increase blood pressure that patients can regularly apply. This method helps reduce the amount of blood pooling in the legs, increase venous blood return, and help blood circulation in the body to take place more effectively. Use oral medication. In some cases, patients need to use drugs to treat low blood pressure as prescribed by the doctor. Drink ginger tea. Ginger is known to be a useful food in overcoming and preventing low blood pressure for patients. When you notice low blood pressure, you can drink a cup of hot ginger tea to improve the condition. How to prevent low blood pressure for patients. Build a reasonable diet. Drink plenty of water. Limit the use of alcohol, alcoholic beverages, stimulants, etc. Use foods rich in B12 such as cereals, beef, eggs. Prioritize food groups rich in folate, asparagus, okra, mushrooms, tomatoes, etc. Supplement the necessary amount of salt for the body. Divide meals into small meals during the day. Regular exercise. To improve and stabilize blood pressure, patients should maintain the habit of exercising for 15 to 30 minutes time. In particular, based on health status, choose suitable exercises such as yoga, walking, cycling, tai chi, etc. Build a reasonable rest regimen. To prevent hypotension, a scientific and healthy rest regimen is necessary. Specifically, sleep on time. Get enough sleep. Limit prolonged stress. Maintain a comfortable and optimistic spirit and psychology. Do not stay up too late. Stay up for a long time. Monitor blood pressure at home. Actively monitoring blood pressure at home helps patients grasp their blood pressure and health status most clearly. Therefore, when noticing abnormal signs of blood pressure, they can come up with the most timely remedies. Hypotension can be accompanied by symptoms such as headache, blurred vision, rapid heartbeat, nausea. Very low blood pressure will prevent vital organs from receiving enough oxygen, which can lead to shock. At that time, the patient needs to go to the emergency room immediately.